uh, attention so that they can actually come over. Uh, Another importance of consenting is that it prevents sexual violence. Consent is crucial in preventing sexual violence and promoting healthy relationships. It ensures that all parties are comfortable and actively participating in in sexual activities. Uh, Samuel, just a minute. Uh, can we? I don't know what the agree. I was just taking us through the communicating consent. How we should communicate consent. It should be clear and explicit. Communication. Communication is crucial in obtaining and giving consent. It involves open and honest conversations about desires, boundaries, and limits. Verbal and non-verbal cues can convey consent or express discomfort. Non-verbal, we have different ways we express ourselves. Non-verbal may be a sign of someone to keep quiet, a sign that you do not want. Active consent. Active consent involves actively seeking and permitting each stage of a sexual encounter. It should be enthusiastic, ongoing, and revocable at any time. That as you encounter yourselves as sexually, you should be able to active, meaning that it is the two individuals or the individuals are actively seeking either through question or through those non-verbal gestures. There are different characteristics of a healthy relationship. Mutual respect. Healthy relationships are built on mutual respect for boundaries, decisions, and autonomy. Both partners should value and support each other's individuality. Healthy relationships are built on trust and communication. Trust is essential in healthy relationships. Open and honest communication fosters trust. This is all I think what we know as individuals. If you've been in a relationship, that you need to be trustworthy in your communication. The characteristics include equality and non-violence. If you see relationships that are non-violent and there is equality being practiced, there are chances that they are a healthy relationship. Healthy relationships are also characterized by equality, where power and decision making are shared. They are free from physical, emotional, and sexual violence. Especially, we have gender based violence and physical violence. We hope if you see relationships that are free of these, where emotions, people's physical or sexual emotions are not being hurt, then possibility that they are healthy are there. This takes us into sexual rights and human rights. Uh, Human rights and sexual health. Sexual rights are an essential part of our human rights. They encompass the rights of all individuals to sexual health and well-being. They are just a drop in an ocean of our human rights. Sexual rights majorly look at one's sexuality, whereas human rights looks at the entire diversity of an individual. In 1948, that is when the human rights were signed. In the Human Rights Convention. Sexual rights refer to the basic human rights related to sexuality, sexual health, and sexual well-being. I hope we are now well versed with these definitions. They are grounded in the principles of human dignity, equality, and non-discrimination. Sexual rights include the right to make informed decisions about one's sexual life, access to sexual health services, and live free from violence, coercion, and discrimination, which is virtually sexual health, as we earlier discussed. The intersection between sexual rights and human rights comes in that there is right to access accurate sexual health information, education, and services. There is a right to make autonomous decisions about one's body. There is a right to live free from violence, discrimination, and coercion based on one's sexual orientation, gender identity, or expression. There is also a right to enjoy safe, consensual, and pleasurable sexual experiences. The intersection is that whereas these are sexual rights, they are also human rights. Universal Declaration of Human Rights, 1948. The Universal Declaration of Human Rights is the foundation of the human rights, and it includes also the sexual rights. It was established and it establishes the principles of equality, non-discrimination, and respect for human dignity. Non-discrimination, as we discussed, respect for human dignity, consensus, but also seeking consent are all principles of human rights. In the Declaration of Human Rights 1948, this is what the statesmen agreed: equality, non-discrimination, and respect for human dignity. The Universal Declaration for Human Rights recognizes the right to freedom of thought, conscience, and expression, encompassing our sexual rights. Now, there are ethical principles that we need to look at. One, as professionals, as social professionals, as health professionals, there is an ethical principle of authority, of autonomy, that an individual has the right to make informed decisions about their own sexual life. You do not have to coerce. Even in reproductive health family planning counseling, you are only entitled uh, to offer the client information about the various contraception that are there, but not to make for them a decision. You can only offer clients information on their diet, but you cannot make for them a decision. This autonomy applies as a human right, but also as our ethical principle as professionals. Therefore, respecting autonomy involves providing individuals with that accurate information, ensuring their capacity to make decisions, and honoring their choices. Beneficence is another ethical principle. Beneficence means acting in a way that promotes the well-being and best interests of the individual. It is in the context of sexual health. It involves providing access to comprehensive sexual health information, education, and support to enhance overall well-being. That you're acting as a as 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 a provider. You're not the one making decisions. You're only equipping an individual with information that can benefit them. If you do not provide them with information that is beneficial, then you're not acting according to this ethical principle number 2. Ethical principle number 3 looks at non-malfeasancy. Non-malfeasancy is looking at the principle of doing no harm. The fact that the health system or health information is asymmetric, in that it is one-sided. You, as the professional, is the one who has the information. You are bound by the principle that you do not practice harm. In sexual health, it involves minimizing the risks associated with the sexual behavior. You ensure that the safety of the individual and you prevent harm in sexual relationships. How? Through offering them counseling, through offering them the right information regarding sexuality. There are different legal frameworks that have come up in handling the issue of sexuality and sexual health. Legal frameworks vary across countries and jurisdictions that influence sexual rights and protections. Laws related to consent, reproductive rights, LGBTQ plus rights, and sexual violence impact the rights and well-being of individuals. Advocacy for legal reforms is essential to protect sexual rights and ensure equal access to sexual health services and protections. There are different legal frameworks. There are sexuality legal frameworks, maybe the Sexuality Act. In Uganda, there has been the famous anti-homosexuality bill that has been passed, and I'm sure many of you have heard the uproar from very many communities that are saying this law is uh, is against the human rights of an individual to make their own decision or to access sexual health, because in the law there are provisions that these individuals practicing same sex should not be accessing uh, health services. So those are just some of the legal frameworks that exist, but different countries have got different legal frameworks or different laws that are uh, that are used for policing or for governing sexuality in different communities. For example, there are different communities or different countries that allow LGBTQ as a sexual orientation, but also as a sexual behavior. Uh, Policies, there are different policies, as I mentioned. The policies are at national and international level, but these policies play a very crucial role in shaping sexual health, but also sexual rights and sexual behavior. And therefore, you may not be able to practice certain sexual behaviors in a certain population. This is how these laws influence. For example, with the passing of the LGBTQ anti-homosexuality bill in Uganda, it virtually makes it illegal for anyone to practice same-sex or gay marriages or LGBTQ related things in the country. That is how far these laws can influence or they shape our sexual health. Policies can also focus on comprehensive sexual education, access to prevention, and response to sexual violence. Advocacy for evidence-based policies is important. So our right as public health people is to identify where our gaps are and then advocate. For example, we still have cultural uh, issues that govern our sexuality. So, which policies, which cultural gaps can we identify as scholars to influence policy? Which research based policy can we come up with to improve our sexuality? If society is allowing girls to get married at 16 years, yet biologically in our research we know that they are not ready. Their pelvic bones are not yet ready to contain children. It is the reason for high maternal death among teenagers. So then how can we use that evidence to inform policy regarding how teenagers practice their sexuality? Advocacy strategies for sexual health. Advocacy strategies for sexual health aim to promote and protect the rights and needs of individuals and communities in relation to their sexual health. Advocacy, like I have said before, plays a vital role in shaping policy and promoting sexual health at various levels. And if you have evidence based advocacy, it gives you an upper hand uh, in, uh, in, 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 in asking for policy. Effective advocacy policies include building alliances and coalitions. For example, the LGBTQ communities are now using coalitions and alliances to further forward their information on LGBTQ rights. There are also women advocacy groups that are advocating for women rights. So these are examples of how you can strategize to build effective advocacy. Engaging in evidence-based, which I have talked about, you need research of causes of teenage pregnancy and teenage maternal health in order to advocate better. You need to conduct public awareness campaigns to raise visibility and promote dialogue. Lobbying policymakers and engaging in policy dialogues is yet another effective strategy. You also need to mobilize communities and affected populations to participate in the advocacy efforts. because we very well know the role that the community can play in advocating for their own rights. Collaboration among various stakeholders, for example, governments, NGOs. Governments, most times we have seen them sign policies, for example, the health policies, the sustainable development goals. All these are strategies that they are using in order to promote better sexual health. Who are the key stakeholders in promoting this? Who are the key stakeholders in sexual health policy and advocacy? Before we go into that, there are a lot of us play now a key role in advocacy. And as individuals, you should take keen interest in advocacy. Key stakeholders include NGOs, non-government organizations that are working on SRI, HRI issues. Government agencies responsible for healthcare, community-based organizations, researchers, academic institutions, all these are key stakeholders. Their efforts can be through coordinated action. They can do resource sharing, but they can also do resource mobilization. What are the key reasons for evaluating sexual health programs? Assessing programs, program outcomes, and identifying areas for improvement. If you are able to evaluate the sexual health programs we do have, then you can be able to identify issues for improvement. But also, evaluation helps to demonstrate effectiveness of programs to stakeholders, whether a program is worth it or not. It helps to inform evidence-based decision making for resource allocation. So if you evaluated a health program, for example, our colleague who was saying he implements reproductive health issues in the community, if you're able to realize, uh, if you're able to have evidence of how your program is making strides, then you can influence resource mobilization or resource allocation also there. Enhancing accountability and transparency. If you are evaluated, then we're able to know our value for money. Then contributing to the body of knowledge. Evaluating helps us identify and it helps us improve uh, the knowledge we have regarding those issues. Now, what are the emerging challenges and opportunities in addressing sexual health? Technology and sexual health. Technology offers us new opportunities for enhancing sexual health promotion and services. As a take home, you also need to identify, whereas technology is helping us, it also has come up with challenges. And therefore, we need to identify what are the challenges, but also the opportunities that this technology has brought forward. E-platforms, telemedicine, and mobile apps provide access to sexual health information, counseling, and support remote. So now this is the advantage of having technology around us. It helps us facilitate discreet and confidential communication between healthcare providers and individuals. If we're talking about issues of privacy, we do not nearly need to go to a health facility. We can just talk online like the way we're doing now, which means no other person can only hear the confidential information we have. It enables self-monitoring of sexual health behaviors. We can track contraceptives or STI testing. All these as a result of telemedicine, self-testing kits. They also offer sexual health education. Mostly we talked about internet. Emerging challenge two, we are looking at addressing stigma and discrimination. We discussed stigma in large already and discrimination. So we can go ahead and look at the remaining four slides, and we are able to look at strategies for addressing stigma, which largely we already discussed in our earlier discussion. But as a peruse through, promote comprehensive education, sexuality education, so that the myths in the community and misconceptions can be counteracted. But also, we need, as healthcare workers, we need to be non-judgmental in the health environment. We need to advocate for policies that protect individuals' rights. However, we also need to engage in public awareness campaigns to reduce the society's stigma towards sexuality issues. Promoting healthy relationships and consent education as another emerging issue we talked about are vital. Promoting healthy includes providing comprehensive sexuality education that includes information on consent, communication, and healthy boundaries. We also need to address power dynamics. In power dynamics, we're looking at uh, the power dynamics that plays between female and male in terms of decision making. What are our gender norms back there regarding sexuality? They do not allow young people to discuss sexuality issues in public. What are the social issues that influence relationship and sexual behavior? The friends, your family. These are all issues. Most times, when our family members come into relationship issues, they create a lot of violence. These are the issues we need to promote. Healthy, in promoting healthy relationships, we need to promote positive social influences. Empowering individuals to make informed choices and communications. This is through sexuality education, but also through economic empowerment. Engaging parents, schools, and communities in promoting healthy relationships and consent education. So this gives us a right or a project to go to our home communities and help inform our schools and our communities. And lastly, addressing sexual health during public health crisis, ensuring continued access to sexual and reproductive health care services amid these disruptions. Whether, for example, in the issue of COVID, that was a public health crisis, in an issue of an outbreak of a disease, we must ensure continued access to SR services. If sexual and reproductive health services are discontinued in terms of disruptions, then we shall have more public health issues emerging. For example, in Uganda, it may not only be in Uganda alone. When the COVID issues came up, when COVID-19 came up, a lot of lockdowns were done and people could not access sexual reproductive health issues. We saw a very high rise in teenage pregnancies. This is just to show you how much absence of sexual reproductive health services can affect and can become more public health crisis. Addressing the impact of social distancing measures on sexual behavior and relationship. We need to provide accurate information about sexual health risks, the risk of not being open to your partner. You need to openly discuss to individuals or to our society the risks that are associated with sexual health. If we have a bad sexual health, how it can affect our public health. Incorporating sexual health into broader public health emergency response plans. So, if we are responding to disease outbreaks, we must incorporate issues of sexual health so that we do not divert away from addressing issues of consent and public sexual health. I think, Samuel, that ends my presentation. Unless we have other issues, but I think I have